In this study, we looked at the impact of cardiorespiratory fitness on COVID-19 related outcomes. I'm Jonathan Myers from the VA Palo Alto Healthcare System and Stanford University, and I'm going to say a few words about a study that was just published in Mayo Clinic Proceedings. The study is entitled Impact of Cardiorespiratory Fitness on COVID-19 Related Outcomes, the Exercise Testing and Health Outcomes Study. It will be published in the November issue of Mayo Clinic Proceedings. The study is from a collaboration with colleagues from the VA healthcare systems in Washington, D.C. and Palo Alto, California. The study is known as the Exercise Testing and Health Outcomes Study, or by the acronym ETHOS. Beginning more than 30 years ago, the project is an ongoing prospective evaluation of veteran subjects referred for exercise testing for clinical reasons, designed to address exercise test clinical and lifestyle factors and their association with health outcomes. Along with my colleagues at the Washington, D.C. VA, the ETHOS cohort has provided an opportunity to study many different health outcomes as they relate to various exercise test responses, particularly cardiorespiratory fitness. Now, we all recently experienced a transformative, once-in-a-century pandemic that dramatically changed our work and personal lives. The COVID-19 pandemic caused an enormous amount of suffering worldwide, revealed deep inequities in healthcare across the globe, and placed an unprecedented burden on healthcare systems. Among the things we learned from the COVID pandemic is that individuals who are less healthy, had existing health conditions or risk factors such as hypertension, obesity, diabetes, those who were smokers, or individuals who were physically inactive, did much worse if they acquired the COVID-19 virus. A particularly powerful risk factor that is often overlooked is poor cardiorespiratory fitness. Over the last 3 decades or so, what our group and many others have observed is that individuals who have higher cardiorespiratory fitness have much better outcomes when followed over many years. In other words, they not only have lower mortality, but they have a lower incidence of chronic conditions such as heart disease, cancer, kidney disease, or diabetes. In our study, we followed more than 750,000 subjects for an average of 15 years. When we looked at these subjects' medical records, more than 23,000 had a positive test for COVID in 2020 and 2021. So we were interested in how cardiorespiratory fitness impacted COVID-19 related outcomes among these 23,000 subjects who were COVID positive. We looked at COVID-related mortality, COVID-related hospitalizations, and another important outcome, need for intubation while in the hospital, a sign of the severity of a given patient's illness. Some key results are shown in this first figure. This is a forest plot showing cardiorespiratory fitness categories, comorbidities, and COVID-19 mortality risk. And I'll just direct your attention to the top of the figure that shows COVID-related mortality in the 5 groups categorized by fitness. When we divided the group into quintiles of fitness, with the least fit quintile as the reference group, you can see that as subjects were more fit, their mortality decreased. Comparing the most fit subjects with the least fit subjects, those in the most fit group had about half the mortality as those in the least fit group. I should point out also that these results are adjusted for 15 comorbidities. The unique size of the data set allowed us to do that. Similar to other studies, we found that those who had an existing condition did far worse when they acquired COVID. This next figure shows the impact of fitness on severe COVID-related outcomes in 4 of the more common comorbidities: obesity, diabetes, hypertension, and chronic kidney disease. You can see that, again, the fittest subjects, the bars on the right with the arrows, had about half the risk of a severe COVID-related outcome compared to the fittest subjects, even in the presence of one of these existing conditions. And finally, I think there are several key takeaways from these results. First, low cardiorespiratory fitness is largely a modifiable risk factor that is associated with more severe COVID-19 related outcomes. The public health implications of these results include the fact that efforts to enhance fitness by promoting regular physical activity should be made. Such efforts would strengthen an individual's resilience to COVID-19 variances, some of which we're experiencing now, and also future viral pandemics, particularly in high-risk individuals. Higher fitness also has the potential to mitigate existing risks for severe COVID-19 outcomes, such as diabetes, obesity, and hypertension. We're a couple of years now beyond the peak of the pandemic, and we're just beginning to see the impact of long COVID on various health metrics. Further studies are needed to assess the impact of fitness on risk of complications due to long COVID syndrome, and that's a topic of a forthcoming study from our group. Thank you for your interest.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.